Hi, my name is Dr. Richard Wyckoff, and this is Dr. Salil Mandari.
Hey there.
We're with McGovern Medical School at UT Health with the Department of Emergency Medicine. We're going to be walking you through sterile central lines to be differentiated from non-full sterile central lines or crash lines. With the sterile central line, every step of the procedure uses sterile technique. So at Herman LBJ, there's a few things you'll have to grab. At Herman, you're going to want to grab a sterile pack. The sterile pack has sterile blankets, sterile towels, 2 hats, 2 masks, and a Tegaderm with an antimicrobial film. The next thing you're going to want to grab is a central line kit. You're going to want to pay attention to what the central line kit says on it. So this is a 7-French to be differentiated from a Cordis, which is larger, a triple lumen, and 20 centimeters long. This will work for our central line. Next, you're going to want to grab a sterile probe cover. I'm going to drop this in the kit. I usually grab 4 additional chlorhexidines. There's 1 more in here, so that'll give us a total of 5. I then grab 3 caps. Since this is a triple lumen, we'll need 3 of these, and we'll drop this in the field. I grab some extra gauze. Sometimes it can get a little messy. I grab my gloves, so mine's size 7. We'll put that in there. And then I grab some flushes. So you'll find these flushes in the closet. These are sterile flushes, which you can open up and drop in the field. You'll also find these flushes, which are not sterile. You cannot drop these in the field, but you can squirt them in. We'll use these ones. These are my preference.
Perfect. Richard, can you just talk about the differences between Herman and what may be different at LBJ and when you gather your equipment?
Certainly, Dr. Mandari. At Herman, you'll find these sterile packs. At LBJ, these don't exist. We don't use blankets over there. You'll just use the normal size drape. The other thing is, you might notice that the probe cover looks a little different there, but you'll still need one. And then at LBJ, we also use these little bio patches, which at Herman we don't need because we use these. These are the biofilms.
Hey, Richard, do you mind just discussing now how you go about kind of positioning your patient and kind of getting all your equipment set up?
Yeah, we can get started. So first we're going to want to make sure we have a consent on file. If we have the consent on file, we're going to start off with a timeout. So I'll introduce myself, I'll say my name, I'll check that we have the right patient name, that we have the right patient MRN, and then we'll make sure everyone in the room is in agreement with what we're going to do, including the nurse. So now we're going to get started. We need to make sure our patient's in the right position. So there's a few things you want to do to get the room set up. So for the IJ, I like to be at the head of the bed. I want to make sure that the ultrasound is in my line of sight. So I'm going to have it on my left if I'm doing a right IJ, or if I'm doing a left IJ, it's going to be on my right. I like to make sure that wherever I put my supplies is right on my dominant hand. So on my right hand, I'm going to put all the supplies. There's none of this funny business of crossing over. And then we want to make sure our patient's positioned appropriately. So if we're going to do an IJ, the ideal position is in Trendelenburg, 15 degrees. Past 15 degrees, you really get no benefit. So we'll go ahead and lower the bed to about 15 degrees. The next thing in an awake patient or a sleeping patient, we're going to want to make sure the neck is positioned in the right position. So sometimes you'll see people turn the head all the way over. That's actually going to worsen your view. So what you're going to want to do is turn the head a little bit to the left, no more than 30 degrees. Past that, you're actually going to decrease the diameter of the lumen. So we'll just pretend this is a real guy, and we'll just tilt him a little bit, 30 degrees. You can sometimes put a little blanket here if you want to support him. And before I put a drape on my patient, I like to put a little oxygen mask on their face. It's mainly for patient comfort. Now we're ready to break open the supplies. So the first thing I like to open up is my sterile pack. So inside this one, you'll find the blankets. So we just set this aside on another table or tray. And we're going to open this sterilely, not touch the inside. Next, you'll find some towels. We're going to open this sterilely as well. And we're just going to carefully, making sure that we're not touching, drop this inside. Next, we have a hat and mask. So everyone that's going to be close to the patient should have a mask on. That means even you, Dr. Mandari.
Thank you, sir.
So we'll put on our hat. we'll put on the mask. And now we have 2 gowns. One for you and one for your supervisor. The next thing I like to do is open up my central line kit and get it ready right on the head of the bed for myself. So this is our central line kit. I like to take it out. Here's the 5th chlorhexidine that we were talking about. And we're just going to open this up sterilely. So we can touch the outside, but we cannot touch the inside. Next, we're going to drop all the supplies in, one by one. Here's the Tegaderm. I'm going to drop 2 chlorhexidines in. This was our sterile probe cover.
Because there's 1 chlorhexidine already in there, correct?
There's 2 in there now.
2 in there now.
And we'll drop the sterile probe cover in. We need 3 caps, so one by one. I drop my extra gauze. Remember that we can not touch the inside of this. And with these flushes, we can actually drop these in sterilely as well. And then we'll set my gloves aside so that I can get ready to use them for gowning myself. So before we clean out the patient, we're going to check and look at the patient's position of the carotid artery and the right IJ. And this is a great time to adjust the depth and the gain of your ultrasound before you get started. So we'll take a look. We're looking at for the indicator, so I just switched it. So now you have this dot, and we want to make sure our dot's lined up. And so now we're looking for the vessels. We want to see how the position is. So you want to make sure that you have your IJ and your carotid artery in view.
And if you can just point out the carotid artery and the IJ.
So you'll notice that you have a pulsation where the carotid artery is. The wall may also look different when you take a look at it. This is a mannequin, so it looks not too different. And then if you look at the IJ, if I press down on it, you'll notice that it collapses. So now that we've found the patient's vessels, I like to map them. I like to see where it goes. So I'll just scan down. And I scan up. And I'll find that ideal position of where I'm going to put my needle. So I'm looking at my anatomy, looking at my clavicle, looking at my sternocleidomastoid. And I think we're ready to begin.
Perfect.